Hello, I'm Senate Republican Leader Mitch McConnell of Kentucky. Earlier this week, the President signed a massive health spending bill that's been described as historic. Well, Democrats in Washington may measure history by how expensive and intrusive the bill is, but most people outside Washington see things differently. In one of the most divisive legislative debates in modern history, Democrats decided to go the partisan route and blatantly ignore the will of the people. Americans opposed this legislation, and now they're clamoring to see it repealed and replaced. Democratic leaders and White House officials may be celebrating their victory this week, but most of the rest of the country is not. Most people aren't interested in celebrating a bill that makes their lives more complicated, takes more out of their paychecks, and puts decisions they're used to making themselves into the hands of federal bureaucrats. Most people aren't celebrating the fact that their insurance premiums will go up. Seniors aren't popping champagne corks at more than $500 billion in Medicare cuts, and job creators already struggling in a down economy aren't doing any cartwheels over all the mandates and new taxes they'll have to shoulder as a result of this bill. We're already seeing the economic fallout. Just 2 days after this bill became law, the John Deere Company said it will spend an extra $150 million this year alone just to comply with the new law. Illinois-based Caterpillar Corporation said it expects to take a $100 million hit. This is bad news for workers, and it's terrible news for the broader economy. As the President himself put it during a visit to Caterpillar last year, you can measure America's bottom line by looking at Caterpillar's bottom line. That was the President a year ago. The timing couldn't be worse. At a moment when millions of Americans are looking for work, Democrats in Washington just voted to spend $2.6 trillion on a health care bill that will make it even harder to create private sector jobs. The IRS sure gets a boost, though. An estimated 16,500 new workers will be needed there to enforce a brand new insurance mandate that the bill imposes on employers. And then there are all the unintended consequences that will inevitably result from a 2,800-page bill that sets up dozens of federal boards and a thicket of new rules and regulations. Regulations that we know won't withstand their first contact with reality. In fact, we're already seeing it. Just 1 day after the President signed this bill into law, we got word that one of its celebrated early features, a ban on discriminating against children with pre-existing conditions, won't immediately protect children after all. Another promise, requiring insurance companies to let young adults stay on their parents' plans up to age 26, turned out to be similarly ineffective. In other words, Democrats in Congress just voted to take over 1/6 of our economy, and two of the biggest selling points they use to push it over the finish line already need fixing. Here's a question. If they can't get these two things right, how can we expect them to properly manage the rest of it? When the White House was questioned about the glitches in the bill, they said the Secretary of Human Services was on the case. They said she'd issue a new regulation to correct the problem. But this is precisely what Americans are afraid of. This bill hadn't even been law for 24 hours, and already they're proposing regulations to cover over mistakes and errors. And we haven't even seen the last of it. I'm sure that soon enough, every American will be reminded of the wisdom of that old observation that government is best, which governs least. Look, nobody is satisfied with the health care system as it is. We've got serious problems that need to be addressed. Costs are out of control. Too many people are being squeezed out of the market. But the fact of the matter is, this health care bill doesn't solve any of those problems. It uses them as an excuse to undermine the things we do best: the wide array of choices, the constant innovations in technology and treatments, and the high quality of care that people all around the world admire about the American healthcare system. Sadly, all of those things will suffer as a result of the bill the President signed this week. We can do better. We can expand access to people with pre-existing conditions. We can keep people from being kicked off their plans. We can lower costs and premiums. We can do all of these things without undermining the things we do best and without raising taxes that kill jobs in a bad economy. The American people know that. That's why they've been clamoring for a different approach. And that's why Republicans are committed to repealing this bill and replacing it with common sense solutions that achieve the good things that folks on both sides want to achieve without all the nasty consequences we're already beginning to see. Repeal and replace. That's what Americans really want, and that's something far beyond Washington, D.C. will actually want to celebrate. Thanks for listening.